My name is Dr. Sergio Glait. I'm one of the hand and upper extremity specialists here at the Orthopedic Center of South Florida, and I'm here to talk to you about what is a distal radius fracture. So distal radius fractures are essentially fractures of the wrist. This is my wrist, and when we fall down on an outstretched hand, we typically don't injure ourselves, but every now and then, unfortunately, we can break our wrist, and a distal radius fracture involves a break right here at this level of the wrist below the joint line, or sometimes it goes into the joint line. Now, these fractures are very common in older individuals, although younger patients get them too, and higher energy injuries such as car accidents, falling off of ladders, or just higher energy type injuries. But the older we get, our bones become weaker, and if you have a diagnosis of osteoporosis or osteopenia, and you fall down from a standing level type of height, you can break your wrist as well. And I commonly see a lot of wrist fractures in my office. Not every wrist fracture requires surgery. There are certain parameters that you look at on an x-ray to make sure how deformed the bone is, such as the height and the angles of the wrist joint. And depending on the overall alignment of the wrist, sometimes surgery is not necessary, and it can be easily treated in a cast and have the same outcome with or without surgery. Let me give you an example of what a plate would look like if you were to do surgery. If the fracture is very deformed and obviously needs to be realigned so that you could obtain the best function possible in your wrist, surgery is sometimes recommended. Surgery is also recommended in very active individuals where the fracture goes into the joint and the joint is separated and not level. And so it's important to try to restore the joint surface as best as possible. And we do that by usually making incisions here on the bottom part of the wrist and putting a little plate like this inside with screws to hold everything together once we realign the bone back to its normal anatomy. Typically, when you injure your wrist and you will sustain a wrist fracture, the treatment with or without surgery entails using a cast or a splint. And typically patients are splinted for a period of 4 to 6 weeks. And that's very common with or without an operation. It's also very important while you're healing from a wrist fracture not to put any weight on the wrist and not to push and pull too much, because that could move the fracture, affecting the overall outcome. So if you fall down and you think you may have injured your wrist, some of the common signs that you'll see is bruising around the wrist joint or the hand. If you see bruising, that means something is bleeding. And typically when we break our bone, it bleeds. And so you should seek out immediate attention with an orthopedic specialist or a hand specialist such as myself in order to evaluate your injury further and treat it appropriately.